Literally, we're going to go up, down, and talk about every bone as we go down. So, the first one you can get is your head. And so basically your head can, the skull can fracture. It's a big bone and it can fracture. Those can be dangerous, and they mostly happen what is called skull-base fracture. So basically they're mostly here. They can happen a little bit everywhere. The temple or one place that is very sensitive and very dangerous as well, because the structure is a little bit less dense than the rest of the skull, and there's a big artery that passes right beside here. And so sometimes if you cut this, you can have a big bleed in your head. So this is one, there's not much you can do. Those people will act like if they had a head injury, and they'll have decreased level of consciousness and stuff. But when you do your exam, they can have a skull fracture. The other one too can be a facial. So not much you can do for those fractures. There's not really a, and those ones will be airway management. And you could see that, for example, if someone is caught in an avalanche or just skiing, and they go face first in a tree and basically just smash their face. There's not much you can do, but they can fracture those bones as well. You can have the mandible, it could be fractured. If it's the mandible, only the mandible, basically you could try to, you know, like when people used to have teeth pain, kind of hold it down a little bit for the pain. But then it's the airway management, and just see my video on that one, what you could do. And those one would be a disaster to manage in the outdoors. Then we'll go a little bit in the back, so spinal injuries. So now those are tricky. You can carry stuff to manage them, but you need to be trained. You need to be trained in spinal injuries because they require really special treatments, and it's way more past a podcast video. So basically, we'll show you a little bit here, and we'll talk about the whole spine as it goes, but I'll show you the treatment for the top spine. So basically, this picture right over here, this is what our back looks like. So we have 7 that's called cervical, so those over here, 12 vertebrae or thoracic, so basically the back over here, and then we have 5 the lumbar, so there's kind of like the loop there in the back. All those ones can be fractured. They all have different shape, but mostly they're like this. So basically they have a big body, so kind of a round circulation. The little hole in the middle, that's where you have your cervical spine. So basically your spine process, so basically that's where all your nerves are and everything, and that's the issue that if you damage that, you're paralyzed for the rest of your life. And then you have the spinous process, which is that little piece of bone here, and that can make any bone. So basically those bones are on one and the other on the top like this, and they can either be displaced like this and basically sever your spine and then you're paralyzed, or they can be just unstable, waiting to move. And there's as you can see over here, the 3 lines is kind of what holds it off. There's some ligaments that kind of holds everything together, and if those ligaments breaks as well, then this becomes very unstable. So anything for the spine, the only thing you can do is put somebody on a spinal board. Where do I find a spinal board in the woods? That's a good question. But one thing you can carry, what I carry always with me, is a seat collar. And I carry it this way. So basically when you buy those, they come like this, they're flat, they're not a form like this one is. And so basically they go very well. So this is my backpack that I always carry. And basically it's the back of my backpack. It weighs nothing. And it's worth its weight in gold. So if something happened, then I can use it. This one is a different levels, and basically what it does is that I can adjust it according to the size of the neck that I have. And so basically I can move those pieces up and down as needed, and then I can clip it and put down the chest. So basically what this does, so when you have a fracture of the neck, you want to be sure that no movements like this and no movement like this. And so basically what this does is that it prevents, I'll put it on mine, there. So that's what it looks like. So basically, see, I cannot move like this, but I can still move a little bit like this. So it takes about 80% off the movements of the neck. Again, get trained and you'll know how to use those, but you can carry one in case somebody knows how to use those. If you have anyone suspected of, so basically pain in their back or their neck, numbness in their fingers, don't feel their legs, or if you pinch their legs, if you ask them to squeeze their hands or push their feet and they're unable to do this, those people are considered to have a spinal injury, and you do not move them, because if you move them you get them in the worst condition. But now what if you're in the middle of an avalanche path? That's part of wilderness medicine. So now you have to take a decision. Do I move this person and get them paralyzed for the rest of their life, or leave them in a danger zone and they're most likely going to die again? So that's why wilderness medicine, it's a very hard, it's a lot of decision, and that's why we keep saying train, train, train in courses. But yeah, so basically this is what I would use for the neck and the back. The back, you don't need to put any kind of anything, but basically when you turn the person, and we talk about that a little bit on the airway, when you turn the person, you have to turn them in what we call the log roll. So basically the person has to turn, basically this back has to stay straight. One thing that you can improvise is a smaller spinal board if you want to. And so basically you put a backpack upside down. You see that here now, if I would attach it, probably it kind of keeps my head with the spinal. So that's an improvisation that you can do from a backpack. So basically you turn the backpack upside down and you attach it and put a seat collar, and good. So another one that we can use for spinal precaution, and again, improvisation, right? So if you have a shovel, it's like a blue pad, and obviously this I'm doing quickly, but you would have to make it a bit quicker. So you see here, if I immobilize my head and this right on my back here, it makes me a structure. So it kind of immobilized a little bit like this, so I could improvise an immobilization. Basically that's what it counts, is that you immobilize this part up to here and here. So anytime that you want to immobilize spinally, that's one way that you can do it, or the backpack. But most of the people, if you don't have to move them, do not move them. The problem now is that you stay out in the elements, so at one point you're probably going to have to move them. So decision is all yours.